Hi, welcome back. Rohrich Knows Podcast, helping you become a better and more informed you. I'm Dr. Rohrich. I'm a plastic surgeon in Dallas, Texas, and let's talk today about fillers, and let's talk about complications. You know, fillers are overwhelmingly safe and powerful, especially if used in the right manner and injected properly. And most importantly, if they're done in an incremental way that's done safely by an injector that knows the anatomy, doesn't do crazy stuff. But even so, you can get into problems. So, and people talk about the danger zones, and I actually have written a book about the facial danger zones. There are 6 of them, but the bottom line is the whole face is a danger zone. It's a very vascular structure, but, you know, I've written a book which talked about, you know, the forehead and the temple area and the perioral and the nasolabial fold and the nasal area and the inferior. All of these are danger zones. They're the high danger zones. And the pathways for getting into trouble are through each of those, and they can cause blindness and skin loss and loss of your nose and lips. So these are very big issues. But you can avoid them in a high majority of cases if you're very safe. So just know before you go, and this is a courtesy of one of my friends, you know, Dr. Arthur Swift, who basically treated this lady. And basically, you know, when you get into trouble with one of these danger zones, you can have loss of skin, loss of vision, and so much more. So how do you avoid these things? And I'm going to highlight it by talking about, you know, all the different fillers, but I'm going to talk about nasal fillers, which are really a high-risk area that probably only should be done by very, very experienced injectors, preferentially rhinoplasty surgeons. And, you know, what are the indications? How do you do it? How do you stay safe? You know, and what do you do to manage and prevent complications? So let's talk about that. You know, nasal fillers are not indicated in a lot of patients, but they're really in 5. Those who want to wear their rhinoplasty, which I see sometimes in college students, or sometimes patients come in about 2 months before their wedding, and of course they say, well, there's no way we can do a rhinoplasty, but they can get the effect of a rhinoplasty, or if they can't afford a rhinoplasty, and sometimes I use it in secondary patients to bridge it to their secondary rhinoplasty when they've had 3 rhinoplasties and they really have to wait for a year or 2 to do their next one. And I will do something to improve their shape and contour. And then there are some that just don't want to have nasal surgery. And then there are some that shouldn't have any more nasal surgery because of health issues. So these are all of the different indications. And remember, the filler is not indicated in a patient with a big hump, because the bigger the hump, the bigger the nose. And fillers make your nose bigger, and they won't further define and refine it either. So here's a lady that just had a lot of other health issues, and she comes to see me every year or 2, and so she's had a previous rhinoplasty, but because of her health, she desired, you know, to correct her saddle nose deformity with a filler, and I see her like I said, every 1 or 2 years, and I augment the dorsum, and she looks quite good, and it looks very natural, and the key is less is more. So where does safety come in? I think most of the safety issues come proximal to the needle. It's not the filler, it's the injector. And I think that's really important. Because here's some myths that lull people into complacency, that you aspirate before injecting. That doesn't matter. And that cannulas are safe, or small needles are safe, or large needles are safe. I think the injector needs to be safe. That's the most important thing. Here are the truths. The injector has to be safe, and you have to know how and where to inject, and in what plane, and when to stop, and never over-inject, and only use biodegradable approved hyaluronic acid fillers. That is so important, especially in these danger areas. And understand the anatomy. You know, stay deep, stay midline, and you know, do an antegrade, retrograde motion. I like to inject in these areas where I'm constantly moving my needle, because that's a lesser chance of getting into anything untoward, including a blood vessel. So that's very important. And remember, the danger zones in the blood vessels of the face are very, very highly variable, as you can see from the facial artery here. It's very variable, and the danger zones in looking at the nose, for example, are significant because it's highly vascular. So you can see all the blood vessels are superficial, the angular vessel, the lateral nasal vessel. These are all very superficial, so you have to stay deep, stay midline, The anatomy is very, very intricate, so you have to know your anatomy. And the normal skin has these, 5 layers: epidermis, dermis, fat, fascia, and muscle. But in the skin and the nose, it's just a deep subcutaneous tissue and this what's called a SMAS layer, and then the bone. And how do you prevent complications? Well, you inject slow and incremental, antegrade, retrograde in high-risk areas, and use a small needle in high-risk areas, or a blunt needle, and then know your anatomy well, because the embolization routes are 6 ways to blindness. Just to remember that, and you've got to know them as a surgeon. And even if you're an excellent injector, these things can truly happen. So know your anatomy, know it cold, and if in doubt, don't do it. And if there's a revision, rhinoplasty patient, the anatomy is distorted, so I would not do it unless you're highly experienced in rhinoplasty. And then if you get tissue necrosis, the key thing is you got to see that patient. If they call you at night and they have things and signs like this, you got to see them immediately. Do hyaluronidase, which helps reverse tissue necrosis and helps melt the hyaluronic acid, and inject it at 10, 15-minute intervals until it's pink, and don't leave it till it's not, and then give them some aspirin, but most importantly, follow them up and consider hyperbaric oxygen therapy for 5 to 7 days in these patients. Hylenex is recombinant hyaluronidase, and it's brilliant for managing these types of issues. So use it, make sure that you follow the patient, make sure that the skin is pink, and then send them for hyperbaric oxygen, follow them. So I can't tell you enough how important that is. And then keep the area moist. So flood it, aspirin, hyperbaric, moist treatment with ointment, and monitor them. So you can see in this filler complication, that's exactly what was done by an excellent plastic surgeon. And you can see the treatment was amazing, and she recovered completely. So I cannot tell you how important it is to follow your patients, remind them of that, so that they can have your phone if they need it, and make sure that you have this as part of your armamentarium. Anytime you're doing any type of filler injections, make sure you have a lot of hyaluronidase injectable available for you immediately. And God forbid, if you get blindness, you just call an eye doctor immediately, transfer to them, elevate the head of the bed, give them a Diamox, which helps to reduce their blood pressure in that area. And if you're trained, do a retrobulbar, a hyaluronidase injection, aspirin, and hyperbaric oxygen. But the most important thing is get them to see an eye doctor immediately and get them to the ER. Those are very, very important. So stay informed, know the anatomy, inject slow pressure, antegrade, retrograde, know your anatomy, make sure you have your hyaluronidase available, and just always have the fear of God in you every time you're injecting in one of these danger zones. So know before you go, find a highly experienced injector, and Godspeed. Give me your comments, give me your thoughts. Look forward to your next episode of Rohrich Knows Podcast. Stay safe.